joining us. We're waiting. Hi, everyone. We see yellow hands and waving, and this is so cool. And I'm going to get us started. You're in the room of the Alzheimer's Prevention and Research panel. I'm Adam Shapiro. I'm extremely. Hi, everybody. Sandy's here. Nice. We've got some great panelists here. I'm Adam Shapiro. I'm going to be the moderator. I'm just a huge fan of the work that HFC does. I'm an actor. I'm actually coming to you live from Budapest, Hungary. Isn't Budapest beautiful? Where I'm shooting a really fun TV series, a John Wick prequel TV series, which will come out at some point, but it's very, very cool. So it's nighttime here. I'm so excited. And I'm coming to you as a fan of HFC and of all the panelists and as an ally in this. I'm not in the throes of this. I'm not currently a caretaker, but I do believe that in order to take the information that we're learning and we're gathering to the next level, I think that it's going to take more allies and more people joining this fight against Alzheimer's that aren't necessarily just in the thick of it. And so I'm just really honored to be here and really happy to be here with all of our panelists who are, first we have Phyllis Ferrell, the Global Head of External Engagement for Alzheimer's Disease and Neurodegeneration at Eli Lilly and Company. Thank you for joining us. We've also got Nancy Lynn. Hi, Nancy. Senior Vice President. Hey. Strategic Partnerships at Brightfocus Foundation. They're funding global research and generating public awareness to understand and treat Alzheimer's disease, macular degeneration, and glaucoma. And you're producing a documentary that's coming out this year, right? Another one. That's the Gene Wild.
Yeah, we did one on Glenn Campbell and one on a drug trial, and now we'll be doing one on Gene Wilder. Gene actually passed with Alzheimer's, which is not widely known, but what a great career. So,
seriously. Yeah. I can't wait. I'm really looking forward to that. Dr. Laurie Ryan is here. Hi, Laurie.
Hi.
The chief of clinical interventions and diagnostics branch in the Division of Neuroscience at the National Institute of Aging, part of the National Institutes of Health. Thank you so much for coming, Laurie. And Dr. Consuelo H. Wilkins. Hello. Professor of Medicine, Senior Vice President, and Senior Associate Dean of Health Equity and Inclusive Excellence, Vanderbilt University Medical Center. Wait, are you at Vanderbilt right now? Are you coming?
I am. Isn't it lovely?
It looks beautiful. It looks beautiful. I love it. Well, thank you guys all so much for coming. Now, this is we're going to be talking about prevention here. And I want to start with Dr. Ryan, if I may. There's a lot of information out there on various Alzheimer's disease treatment research. What is the research telling us now about Alzheimer's prevention?
Right. Well, thanks, Adam. Thanks for the question, and thanks to HFC for inviting me. But yeah, so actually, the research on prevention is very exciting. We've known actually for a while from both, observational studies and animal studies that there are a number of, risk factors that can influence brain aging and your risk for developing dementia as you get older. Things like, heart disease, having high blood pressure, having diabetes, your level of physical activity, your diet, whether or not you have good social interactions, there are a lot of people around you, your mental or cognitive stimulation, all of those things can actually influence your risk to developing dementia and basically not having a healthy brain as you age it. We say things are good for the brain and they're good for the body. They're also good for the brain, right? Your diet, your exercise, all of that stuff. And so now what we're doing, and it's very exciting, is that there are clinical trials that are examining whether or not we can actually intervene with some of these lifestyle factors or a combination of them. And then can we help, slow or prevent cognitive decline and dementia as people age? Very exciting time.
That is exciting. I mean, I don't, maybe I'm a little naive to it, but I've just kind of always thought of it as an inevitability, as something that I didn't necessarily have control over. But that's exciting to know that there are, lifestyle changes that can be made.
Right. Absolutely. So, you can't, your genes are your genes, you're born with those, but there are things you can do to reduce that risk.
I love it. Phyllis, hi. I wanted to ask you about some of the new emerging research about preventing Alzheimer's. What's new? What's exciting you? What are some things that you're hearing that we're hearing about coming down the pike?
Yeah, well, I want to build on Laurie's comments there. I think people do believe that Alzheimer's disease and cognitive decline is just normal aging. And I think we're here to tell you that the research says that's not the case. It doesn't mean that you can blueberry your way out of Alzheimer's disease if it comes after you,
Sure.
but it means there's things that you can do to make your brain more resilient. And Laurie talked about lifestyle modifications and some of the research there. The other thing we're doing is saying, if we intervened earlier with therapeutics, could you actually catch the disease? So the thing that I find really exciting that's happened just over the last, say, 10 years is we can now see the pathology that causes Alzheimer's disease in a living brain. So it used to be you actually had to do a brain biopsy, which not too many people volunteered for, or you had to wait for autopsy to actually see the plaques and tangles in the brain. And this is really important, right? Because with the stigma of mental illness, Alzheimer's disease doesn't mean you're crazy. We can actually see in your living brain that there's pathology there that's causing ultimately the neurons to not work right and you to lose your memory. And what we know, though, is that pathology starts 10 to 20 years before symptoms.
Wow.
So what you think of, Adam, maybe as someone with Alzheimer's disease is actually very late stage, like stage 4 cancer. And we all know that it's better when you catch this disease earlier. So our research is going earlier and earlier and earlier in the disease. We still have studies for people that have symptoms, but now there's actually studies where you can enroll when you're cognitively normal, find out if you have this plaque in your brain, and potentially get a therapeutic that's in research to see if we can get that plaque out of your brain before it actually causes symptoms. Now, we haven't proven that yet, but the research is out there for people who are interested in participating.
Oh, that's fascinating. Thank you for that. Dr. Wilkins, hi. I wanted to ask you, we know that Alzheimer's disease disproportionately affects Latinos, Black Americans, and women, right? And what is being done to engage these groups in the research trials and the clinical trials?
Yes, unfortunately, these are groups that are disproportionately impacted, and unfortunately also they're underrepresented in clinical research. So, a lot of emphasis and focus lately has been on how do we engage these populations. And I think it's so important that we think about the spectrum of reasons why people aren't engaged now. One is awareness. There still is a lot of stigma around the terminology with Alzheimer's and dementia in general, but also within communities and cultures where, elders are revered, and pointing out these, deficits in memory come with other issues. So, making sure that people realize, as Phyllis mentioned, that this is a medical condition that we need to identify. We need to know the signs. We need to make sure that there is awareness and information available in these communities in different languages and using culturally appropriate terminology. But then also highlighting the fact that if we want to find the answers, we have to make sure that the populations that are disproportionately impacted by the disease are represented in the research. Otherwise, what science are, what is science if we're not studying the people most impacted by the disease? So increasing awareness, removing these barriers like access to the studies, making them virtual when possible, getting out into the communities where people live. And a little bit also falls on us as researchers and physicians. What are our biases? What have we done? How have we created these studies in the past that haven't been designed to actually engage people? So we have to do our part on the other side as well.
Yeah. Oh, thank you so much, Dr. Wilkins. That's great. Nancy, you were shaking your head. I know that you have a lot to say about this as well. I wanted to ask you, because we'd heard about you're at Brightfocus, and we know about the work in brain health. But can you tell us a little bit more about Brain Health Live and the way that they're reaching diverse communities, and maybe add to what Dr. Wilkins was saying about?
Absolutely. Thanks so much, Adam and HFC, for having all of us. This flows perfectly because Brightfocus is primarily a research funding organization. We're funding like $65 million in research around the world, but we have gotten on the ground to see, as Phyllis likes to say, this is hand-to-hand combat. There are so many people who are not aware, are not being reached. The Alzheimer's disease research centers that are set up across the country, can't possibly at this stage reach into not only Black, Latinx, Indigenous, American Indian areas, but rural versus urban. And, so I think one of the things our whole field doesn't remember a lot is how many people we're missing and how many people are isolated. And so I got really excited about this to give awareness without asking for something back right away. Like the way to get people to trust who are distrustful of the research community and the medical establishment, and that's a lot of people, especially if you are not documented or you're just fearful of doctors. A lot of people are. I thought that you should start way upstream, giving information and giving it in an entertaining way, using people like Adam Shapiro and movies like The Father and Still Alice, and doing things that are more engaging, but doing them with people in the community, by people in the community, for different communities, doing it localized, basically customized. So Brain Info Live is this program that we've just kicked off in August with the help of Phyllis at Eli Lilly and Gates Ventures and a little from some from Biogen and Genentech that allow us to produce and give away for free this custom tailored, culturally sensitive, once a month or once every 3 weeks, Brain Health Live episodes, Brain Info Live episodes in English and in Spanish that have a local host. And so it's we'll be doing it for 2 years as a pilot and trying to go into communities that don't have a lot of information and giving to them first.
That's awesome.
Not just asking them to participate in research, right? Just like that.
Yeah. Wow. Thank you. That's great. What was the organization you were saying that was kind of leading that?
This is us, Brightfocus Foundation, but we're not branding it Brightfocus. We're not.
Right.
We're just, anyone can put their label on it. Anyone can use it. It's a free content repository. I promise.
That's awesome. That is really cool. Thank you. Dr. Ryan, I wanted to ask you about what is the NIH learning about the role of prevention and long-term brain health?
Sure. And we talked a little bit about that earlier,
Yeah.
right? We know that there are risk factors, and that if we hopefully can control those risk factors, we might be able to slow or even stop progression, to cognitive decline and dementia. We're also learning from people who, despite you would think that they would have a high risk because they, as Phyllis said, there are brain scans now. We can look at these plaques and tangles, these hallmarks of Alzheimer's. People that have these hallmarks of Alzheimer's, but yet in their 90s might be cognitively normal. So we're trying to learn from resilient people who have some of the brain pathology but aren't showing the dementia, right? So there's a lot of exciting research going on. And I'd also point out that we are looking to prevent, but as Phyllis said, we're also trying to get people who might be at different stages of disease, people who might have, cognitive decline, but they're not at dementia yet. So we call it mild cognitive impairment. And there is actually research going on. Can we stop people from getting into the full dementia phase? And a very exciting study that came out a few years ago, looking at these risk factors. One was high blood pressure, as I mentioned. It was called the Sprint Mind trial. And there were about 9,000 participants in that study. They were at high risk because of kidney disease. And they looked at basically just if we lower blood pressure to 120, systolic blood pressure to 120 or 140, which was the standard of care at the time, what would happen? And in fact, what they did find is that people who were in the 120 group actually had a reduced risk of going on to develop MCI, mild cognitive impairment, which of course is a risk factor. Not necessarily going to get dementia because you have mild cognitive impairment, but you're at much higher risk. So very well showed that, if we reduce this one risk, this blood pressure, can we maintain that? We can have an impact on disease. So I think those are very exciting things that we're learning.
Really, really good to know. Phyllis, the wondering what companies like Lilly are how companies like Lilly are working to advance the path to a cure.
Well, the first thing we're doing is we're supporting women like the ones you see on this panel right now,
Yes.
cheering on the NIH, helping Consuelo with the New Ideas study, making sure Nancy can reach out with Brain Info Live, right? There's a lot of things that pharma companies can't do that they can do. So we want to make sure that they have those resources when they need them. So that's number one. But I think the other thing that we're really trying to do, and it actually taps into a little bit of what Consuelo was talking about around how do we design our studies so people can access them. So this pandemic has sucked. Okay, it's been tragic.
It has.
It is.
I'm so over
We're
it.
all done. Okay. That, by the way, is a technical term, but it's taught us some things, and I think all of us can look at the pandemic and say, what are the couple things that we want to keep? Sure. And one of the things that the pandemic forced us to do was to figure out how to do some things remotely. Yeah. And we are now trying to put those techniques into our clinical trials. See, because it used to be that to be in a clinical trial, you had to drive to a big fancy medical hospital, be there for at least a day, maybe two every month. And Consuelo will tell you a lot of people that are disproportionately impacted by this disease, they can't even get that much time off to go do those things. Or they may not have the transportation, or there may be other logistical barriers. So what we've been trying to do in our studies is make them what we call decentralized, meaning when you have to be someplace, okay, you have to be someplace. But when you don't, can we do our assessments over Zoom? Right. Can we make sure that if you have to get an infusion or a blood draw or an MRI test, you can do it closer to home? And so rather than having to pass 4 hospitals to get to the big research center, you may be able to do that in your neighborhood, someplace where some of those logistical challenges aren't there. Now that's difficult because we have to do that and still keep data integrity and scientific quality and all of those things that the NIH, where Laurie is, and the FDA want us to do. But the pandemic has really pushed us forward in looking at technology, and shame on us for not doing it sooner, but bigger shame on us if we don't take these learnings that we've had in the pandemic and figuring out how we benefit from them later.
Wow. That is so true. I know I'm going to take just like turning down the occasional thing from this pandemic. I really enjoyed being like, you know what, we can't make it. We just want to stay home tonight. I'm taking that with me. I know I'm taking that. I've really enjoyed that.
And we would encourage you to do that. In fact, I think Laurie would encourage you to sleep more.
Sleep more.
Sleep's a big deal. And there's a lot of women on this this webcast right now. Sleep 8 hours, people. And boy, the pandemic has taught us to sleep. So let's keep that part too.
Yeah, that is true. And then you were talking about having to go towns and towns over, but can you also talk about the globally, like how are coalitions around the world helping in this, in that effort?
I think we would tell you, and a lot of the pharma companies that are involved in research would tell you, Alzheimer's disease is a significant beast. It's an enemy, and it's one that we cannot fight alone. Yeah. And so one of the reasons you've already seen, Adam, of all of us already knowing each other is because we're all part of groups that have said, we can't win this by working on it just as one company or one, government agency or one advocacy group. We have to work together. And I've been in pharmaceutical research now for 27 years, and I've never seen anything like the collaboration we have in Alzheimer's disease. And I think that's because all of us know this is a formidable enemy and we need each other. And there are patients that are waiting, and there's no amount of cooperation that we wouldn't be willing to do to figure out a way to tackle this thing faster.
Yeah, absolutely. Adding to that, Consuelo, I wanted to ask you about information on brain health and prevention strategies. How is that information disseminated, and how do we break down those barriers of involvement?
Well, I think, as Phyllis was just talking about, how we are sharing information broadly, that's how we've begun to think about, we have to get information out any and all means.
Yes.
And I think, I've been hearing radio PSAs about memory loss and what to do on the hip hop station that I'm listening to with my 15-year-old. He's probably not really listening to it. He's got headphones in and ignoring me in other ways. But we just have to embrace every possible strategy that we have. A couple of things that I'll say that we are doing, including in the new ideas study that Phyllis mentioned. We're actually tapping into community champions. So we're identifying people who are within their communities, willing to serve as resources. Some of them have been caregivers. Some of them have been, children, grandchildren of people who have had memory loss or Alzheimer's, who are really willing to take on that information, learn it enough to share it with others. And disseminate it that way in different settings, which I think is really powerful. Where are people in a place where they can actually feel comfortable and ready to learn is so important with that knowledge uptake. And then we're also tapping into college students. So how are the folks who are really tech savvy going to share information with each other so that they can then share them within their families? So recognizing this, intergenerational, transgenerational sharing of information, because Alzheimer's disease affects the whole family. And, making sure that everyone has eyes, ears open, listening for those symptoms and being able to help navigate their families through the process is really important. So, we using those as strategies to really bring in people to be involved has been incredibly helpful. I mean, we're doing other things like transcreating materials in other languages. And I say transcreating instead of translating because, we're really recognizing that nuance is lost when you're translating to verbatim to other languages. So, what does it mean to talk about Alzheimer's and memory loss from a cultural standpoint in another language? So let's say it in that language first, instead of trying to just translate exactly what we'd be saying in English. And so excited about all of these new and different ways of communicating, and also saying what you said, Adam, was brain health and recognizing the health piece and not just the deficit piece.
Yes, I love that. Transcreating. I learned a new word today. And it makes so much sense. Brilliant. I love it. Nancy, I want to talk to you about some of the organizations that Brightfocus is funding right now. Can you tell us a little bit about some of those organizations?
Sure, and I'll focus it here on this risk reduction or prevention, because we have, like I said earlier, we have 260 funded projects right now all over the globe.
Good Lord.
Yeah, it's really cool. What's interesting about ours, though, is that they're what we call investigator initiated. We don't say like, we want you to send us your proposals about diet or exercise or sleep. So people come, younger, usually emerging researchers and senior ones will come and say with their novel ideas. So I pulled out just a few of them that we're currently funding that I think people would be interested to understand. Like we say diet, sleep, but what scientists are really going into detail on are things like this. So we have one researcher who is looking at, so when you exercise, you produce a hormone called, I think I'm pronouncing it right, irisin. And they know that this production of this hormone irisin has some of the positive effects of exercise. So this investigator is looking at the underlying molecular mechanisms of the neuroprotective effects of irisin, and how it regulates your immune cells, or astrocytes. So, and the reason why they're looking at this is in the hope that one day you could create a pill that might mimic that effect for those who want to be couch potatoes and don't want to do this. Sure. That's a long way off, but even just to understand why is exercise beneficial to the brain. Another one is looking at reducing the...
Thank you, Consuelo. By the way, no, I don't want to interrupt. I just want to say that there are our panelists and everyone are putting information in the chat. So definitely be sure to save some of those links that people are putting up there. Nancy, please keep going.
Oh, thank you, Phyllis. She put in Brain Info Live link.
Yeah.
So we have a researcher who is looking at whether reducing your protein intake will, can reduce the signs of Alzheimer's disease by increasing a cellular recycling program, or autophagy. I try not to use all the scientific terms for everything, but sometimes it's hard. And then at the same time, we have a young researcher looking at how to image ketones in the brain, if you've heard of the ketogenic diet. So they're looking, so she's doing a project that actually looks at a probe that isn't invasive, but that they can see how the ketone production works. So there's incredible, and I guess you could sense how excited we all are. There's incredible research going on looking at lifestyle interventions that we've all mentioned. And one thing we haven't mentioned that I just want to throw in there is stress. I was on a panel a couple months ago at the Milken Global thing with Deepak Chopra, and he said stress is the greatest pandemic of our time. And it just, I don't know, it just hit me because, we all live these super stressful lives. And I'd love to see more and more research on how, and I know HFC has promoted certain meditation at things, and I'd love to see more about how that affects our brain health.
Way to add that in. Oh God. That is a lifestyle change I think we all need to figure out how to make. Okay, let's keep going. So Laurie, I wanted to ask you about some possible therapeutics in this.
Right, absolutely. So we talked a little bit about some of the trials that are completed, but we have some exciting things going on. We have a very large exercise trial called the Exert trial that's just closed, and we'll hopefully having results within this year. It was for people, again, with MCI to see if exercise, it was prescribed, could actually, again, slow progression to dementia. Another exciting trial that I know Phyllis is very aware of that is not a lifestyle intervention, but a drug trial is the A4 trial, which is in actually cognitively healthy people who are at risk because they have high levels of this amyloid beta protein in the brain on brain scans. So we know that puts you at greater risk. Again, it's not a for sure that you're going to get dementia, puts you at risk. If we intervene early with these people, have the buildup but are cognitively normal, can we again slow or prevent dementia? And that's very exciting because A4 will, after 8 years, it's been a long trial, will be finally wrapping up at the end of this year, 2021, and then we'll have data on that. So very exciting things happening right now.
That's you guys all have me really this has been an exciting, very hopeful talk. Phyllis, I want to ask you about the data that we're developing from these trials and everything we're learning. How has the data sharing changed? You were talking earlier about the fact that we all have to be in this together, and the fact that all of you all know each other and there's so much collaboration going on. But how is that collaboration affecting the way that we share the data?
Yeah, it's actually very, very positive. I mean, Laurie mentions the A4 study. Thanks, Laurie. Yeah. We're actually working on it together, right? The NIA and Lilly are working on that study together. And that's something that happened 10 years ago. She's right. It's been a long haul, but we're getting there. Right. But I think what's interesting about data sharing is, privacy is a really big deal, right? And it's becoming a bigger and bigger deal around patients and people wanting to own their own privacy. But when we speak to people in clinical trials, what they say to us is, when I've decided to be in clinical research, I want you to use my data. And I want you to use it to help me, to help my family, to help my whole community. And so we've been working really hard through a lot of these kind of public, what we call public-private partnerships. So like the one, the A4 that was just mentioned, where we come together and we figure out how do we protect people's privacy by, what we call anonymizing data or de-identifying data, so that you give us your data, but we can tell you that if you get your blood drawn, if you get a brain scan, if you participate in a trial, we know that you've done something to help move this cause forward. We want to be able to tell you that we've used that data every possible way we can. Now, that's in what's called a consent form. And so individuals, consent, and they can always revoke consent. So that's an important part of clinical research. But it's something that we're moving to now. So rather than just looking at our data in silos, how do we make sure that that data, either because it's a sample that's been put in a biobank, or we're going to, like for Lilly, we upload our data to data platforms like Vivly and the Alzheimer's Data Initiative, which Bill Gates's team started. And we try to get that data out there. Now it's de-identified. So we want to make sure that we manage people's privacy. That's really, really important. But what people tell us when they participate in research is they're not just doing it for themselves. They're doing it for their community. Right. And if they give their data, and this I think is especially, Consuelo, I'd be interested, but I hear this especially in communities of color. If I'm going to give and I'm going to participate, I want you to know that I want to know that you've really used my data, for example, to help understand how this disease manifests itself in African Americans. If I'm going to participate, I want to know you've really used it. And that's what we're trying to do.
Yeah, I would just add, just to say that, I'm sorry to put it, that for the A4 trial aid is a public-private partnership. The data is already out there from the screening participants, and it's being used. There have been over 800 people utilizing the data, other researchers. We're learning fascinating things about the way these, the amyloid scans work in different populations. So NIH is all about this as well, and we're very happy to be partnering with Lilly and other nonprofits to make sure the data is made available to the large research community so we can have an impact. I'm sorry, Consuelo, go ahead. I didn't mean to cut you off.
Yeah, no, I was just
Consuelo, go for it.
Yeah.
Dr. Wilkins, Consuelo, can you hear us? Did you freeze there?
It's like she froze.
Am I moving?
Now we can hear you.
Now,
now you're moving.
Now you are.
Now we can hear you and you're moving, and it's great.
Sorry. I was just affirming.
What you were saying. I was gonna. I know you wanted to add to that, and I also wanted to ask you about where folks find these clinical trials. How do people find these trials, and how can people get involved?
Well, certainly, I would just say that community benefit, making sure that there is evidence that data, the results are actually benefiting communities, people like me, is critical for communities of color. I think it's really important, though, along those lines, as we think about where to find clinical trials, that everyone recognizes that they have a right to participate in a clinical trial. I try to make sure that we're saying that for a condition where we still need treatments. We still need the best treatments. We still need a cure. It is your right to participate in a clinical trial. So people should feel like they can ask anywhere. They can ask their doctor, they can ask their neurologist, the primary care doctor, whoever they're seeing, they can ask for information about, where are these trials. The Alzheimer's Association has a tool called Trial Match, and I'll put the link in the chat box.
Oh, thank you.
It has I think over 600 studies right now that are Alzheimer's or some other type of dementia. The other place I'll say is Trials Today, which is a tool that we developed at Vanderbilt, which is actually just taking data from clinicaltrials.gov and putting nice cover on it to hopefully make it easier for people to search. And it's one that we created with the help of community members, community partners in helping with the language and how to make it more usable. But the information is out there, and people should feel like they have the right to be involved and engaged in these trials.
I like that terminology as well, the right to be involved and engaged. Nancy, we're wrapping things up here. First of all, this has been you are all so amazing, and I thank you for being here, and I thank you on behalf of everybody else for for supporting the caregivers. I think this is such a great tool and a great event that HFC is putting on. So thank you for all being here. Nancy, I wanted to end. This whole thing has been very hopeful, but what do you have to say about the hope that is out there? What kind of hope is on the horizon for families that are dealing with this?
Yeah, my mom just turned 92 yesterday, and she's early cognitive decline. So after 14 years in this quote business, I'm now watching my own mom with early stage. And I got to tell you, I'm more hopeful after 14 years in this than I ever thought I would be. And I think you can feel it among all of us, who are collaborating on trying to find answers, not just the scientific answers, but, the dissemination answers, the social justice answers. How do we get all people have a right to participate in clinical research, not just people, who are white information seekers. And so, there's someone at NIA looking at creating community-based research partnerships, like so that you can, maybe participate in a trial with your local doctor. Or, I'm participating in one that has to do with this watch finding out what I'm doing all the time and how it's affecting my brain. There's so many things that everyone can participate in. So it's very hopeful. I'll also say, because when I started in this, I think the government funding for Alzheimer's and related dementias was something like $400 million, which was very low. And Laurie, what is it now? It's over 3 billion, I think.
It's almost 3 billion for Alzheimer's funding right now. So we're very grateful for the increases that we've received. Yes, from Congress.
And I have to say, Adam, one other thing, because you. Those of us who have also been engaging the entertainment industry in this fight, you guys and Lauren and Seth and HFC, you guys can play such a tremendous role, because when people see storylines about Alzheimer's, like in Grey's Anatomy and This Is Us and The Father, and this is probably the easiest way of disseminating information. And the Hollywood Health and Society, Motion Picture Television Fund, they're all involved in it. So encourage all of your colleagues.
Thank you, Nancy. I got my marching orders. I'm as fired up as ever to be an ambassador for HFC from this panel and for everything they're doing today. Thank you, panelists. I wish we could all go out for drinks right now, or some other
red wine. Brain healthy red wine.
Brain healthy red wine. Yes. Unfortunately, we're spread all over the world, but I wanted to thank you guys, and thank you everybody down there, all the attendees. We so appreciate your support with this. And now we are all headed back to the main stage, I believe. Lauren is going to be there now, so you can start heading over there, and we're going to join everybody over there ourselves. Thank you, guys.